By the end of this module, you will understand the legal duties and protections related to mental health, apply ethical principles in first aid and care provision, navigate cultural sensitivities and diverse belief systems respectfully, operate within data protection frameworks, e.g., GDPR, act to prevent and challenge discrimination in mental health spaces. Mental health care, unlike physical health, is often challenged by societal stigma, legal complexities, cultural sensitivity, and ethical dilemmas. Module 8 addresses these sensitive but essential areas, preparing you to respond with legal compliance, ethical clarity, and cultural competence, while prioritizing human dignity, confidentiality, and safety. This module is particularly crucial for healthcare professionals, support workers, educators, HR professionals, community leaders, and all first responders who may encounter individuals in psychological distress or post-crisis situations. It anchors your understanding in rights-based mental health care, data protection laws, e.g., GDPR, consent protocols, and non-discrimination policies, making you not just effective, but legally and ethically accountable. Legal frameworks governing mental health. Mental Health Acts, UK and EU, includes rights to access treatment, protection from unlawful detainment, the right to be informed, and the right to appeal decisions. Informed consent, a cornerstone in psychiatric treatment. Patients must be informed and voluntary in their acceptance of care unless incapacitated under specific legal frameworks. Mental capacity assessments determines an individual's ability to understand, retain, weigh, and communicate decisions. Detention and involuntary treatment, conditions under which individuals may be detained under mental health laws, e.g., UK's Mental Health Act Sections 2 and 3. The Americans with Disabilities Act, ADA, and Equality Act 2010, UK, prohibits discrimination based on mental health in employment, education, and access to services. Confidentiality and disclosure, laws governing patient privacy and exceptions, e.g., when there is risk to life or harm to others. Ethical principles in mental health response. Autonomy, respecting the individual's right to choose or refuse treatment. Beneficence, acting in the best interest of the person receiving aid. Non-maleficence, avoiding harm, especially with regard to restraint, forced medication, or neglect. Justice, ensuring fairness, equal access to care, and avoidance of bias. Fidelity and veracity, being honest, reliable, and maintaining trust. Real-world ethical dilemmas include breaching confidentiality to save a life, respecting refusal of medication from a suicidal person, choosing between individual rights and community safety. Cultural sensitivity and diversity in mental health. Mental health is not experienced the same way across cultures. Cultural backgrounds influence perceptions of mental illness, e.g., spiritual, ancestral, supernatural causes, help-seeking behavior, e.g., reluctance to see psychiatrists, trust in medical systems, especially where historical abuse exists, stigma, shame, and family honor. The culturally competent responder must use inclusive, non-assumptive language. Avoid imposing Western clinical models inappropriately. Acknowledge indigenous, spiritual, or religious healing systems respectfully. Work with interpreters, faith leaders, and cultural mediators. Avoid stereotyping based on ethnicity, gender, or age. Frameworks such as CAMS UK and transcultural psychiatry guidelines are foundational to this process. First aid in legal and ethical contexts. When applying mental health first aid, responders must be aware of mandated reporting laws, e.g., suicidal ideation, child abuse, domestic violence. Respect boundaries, especially in schools, workplaces, or online platforms. Avoid diagnosing. Leave that to professionals. Never coerce, pressure, or shame. Document any intervention and report appropriately using formal procedures. In cases where an individual resists support, apply non-judgmental listening. Engage third-party advocates or crisis teams. Use active de-escalation techniques rather than force. Offer multiple support pathways, maintaining their sense of control. Data protection, record keeping, and GDPR, Europe-specific. With the introduction of General Data Protection Regulation, GDPR, all mental health records must be securely stored. Consent must be explicit and revocable. Individuals have a right to access, correct, or delete personal data. Data must only be shared with legal basis, public health, safeguarding, or emergency exceptions. Mental health practitioners and responders must obtain written consent for referrals. Avoid storing data in unsecured devices or cloud platforms. Never discuss mental health disclosures publicly or with unauthorized persons. Reducing discrimination, marginalization, and institutional harm. Key strategies for this are: use inclusive language, avoid crazy, lunatic, psycho, etc. Advocate for reasonable accommodations in school, work, or community. Acknowledge historical trauma in marginalized populations, e.g., indigenous communities, LGBTQ+, migrants. Foster safe spaces for mental health discussions without fear of retaliation. Implement anti-stigma campaigns in workspaces and educational settings.